sensitive and adorable of all living beings are the newborns, the neonates. To take care of this fragile population's skin, we need to know what's normal, what's common, and what's serious about their skin conditions. And to elaborate more on the topic, there can't be anyone better than a seasoned and experienced pediatrician. Our next speaker is currently working as Head of Department Pediatric Services, Institute of Medical Sciences, and has led the Departments of Pediatrics at Children's Hospital and Gujranwala Medical College as well. With a lot of international collaborations and authorship of several articles, books, and guidelines to her contribution, we are privileged to have you here today, madam.
Big hand.
Welcome Dr. Tayyaba Khawar. She will share her knowledge on neonatal dermatology.
Assalamualaikum, Bismillahirrahmanirrahim, and thank you very much. Special thanks to Faria for. Forward here. Special thanks to Professor Faria for inviting me on this topic, and it's really very. I'm delighted to be in the company of such seasoned and excellent dermatologists. So, pediatric dermatology is something which has been ignored as has been, neonatal and pediatric dermatology. In reference of neonatal dermatology, you can have endless rashes in children, but I thought that today we would touch upon when to consult a neonatologist and when to safely deal with a neonatal rash. So before I begin my presentation, a general usul aap yaad rakhein. A newborn, this is a rough and ready rule. A newborn who is feeding well and is gaining weight is a normal newborn. So rashes are very rampant in the initial 1 month of life and there are various causes to it. आपके पास भी rashes आएंगे. Question ये राइज होगा कि किसको आप सेफली रख के काउंसल कर सकते हो, एडवाइस कर सकते हो और किसको आपने पीडियाट्रिशियन या न्यूरोलॉजिस्ट के पास भेजना है. Any systemic signs in a newborn, and the earliest sign of being unwell in a newborn is that he or she is going to stop feeding. तो कहीं पे भी आपको कोई systemic sign मिले ना तो please refer. So with this kind of take-home message given right at the beginning of the talk, I will continue. I have no conflict of interest in this presentation. So as I've already talked about the importance of recognizing a well newborn from an unwell newborn, a newborn who presents with rash, and this is my single message to all of you here. Any systemic signs in the newborn, please consult the pediatrician. Okay, so we'll talk about transient vascular phenomena first, and this is something that all of you have seen. So the postgraduates amongst you, what is this condition? Yes. So this is status. This is cutis marmoratus. This lacy reticular pattern appearing on the skin, and this is you just have to use an eye of conviction to pick it up here. More visible in fair-skinned children, very commonly seen in the newborn population, and this is due to vasomotor instability in the newborns. And as I said, the child would be otherwise well, and this is going to respond very, very quickly with the warming the child. Usually babies are feeling cold, and this is when they display this phenomena. So मुझे पिछले दिनों I had a call. The mother was at her wit's end कि ये मेरे बेबी को ऐसा रैश हो गया, जरा देखें आप. And then I had to reassure her कि नहीं, इसको आप गर्म कर दो तो ये ठीक हो जाएगा. And this phenomena can actually persist for months. So the second very common vascular phenomena, सारी आपने कहा ना टाइम कम है तो फिर मैं तस्वीरें दिखा देती हूँ, is harlequin color change. Again, this is seen in healthy newborn babies. It can persist for until a few weeks of life. Again, the cause is vasomotor instability, vascular tone की instability होती है, and this is very dramatic. It's a very clear-cut, very well-defined line between two halves of the body. This is seen when the baby has been turned on the side for some time. So जो dependent part है वो erythematous हो जाता है, और जो part which is like uppermost, so this baby must have been lying in left lateral position, वो blanch कर जाता है, and there's a very well-defined line. This is seen more in fair-skinned children, गोरों में ज़्यादा नज़र आता है, and this phenomena can last for a few seconds to about 20 minutes. Again, the baby is generally healthy. As soon as the baby starts crying or muscular tone उसकी increase होती है, this phenomenon disappears. It may be missed many a times because the babies are swaddled, so face पे इतना नजर नहीं आता. You see this usually on the trunk of the baby. So ये common vascular phenomena है जो vasomotor instability की वजह से आते हैं. Okay, so then again a very common newborn rash, erythema toxicum. So this is seen, I should say, almost in 70% of newborn babies, and this is what it looks like. It can appear on the face, it can appear on the trunk. There is an erythematous, it's basically a maculopapular rash, or vesicle, इसके ऊपर pustules भी बन जाती हैं. If you take the fluid out of these pustules and examine it with either Giemsa or right stain, तो उसमें eosinophils आपको मिलते हैं. And this can sometimes become a tricky rash because it becomes difficult to differentiate it from staphylococcal skin infection and from other not so safe rashes. Herpes के साथ बाज़ दफ़ा confusion create हो जाती है. If in doubt, just make a smear on a slide, stain it, and if you see eosinophilic predominance, then it is erythema toxicum. Again, very common, and parents get very distressed. Again, there's a child with erythema toxicum. ये postnatal check के लिए मैं गई थी तो उसके face पे था. So it fades over 5 to 7 days, but may continue to recur over several weeks. Okay. Then another common rash is this vesicopustular rash, which is less common than erythema toxicum, and it is seen in 0.2 to 4%. Erythema toxicum, तो आप समझे हमारी population में up to 70% में, up to 70-80% में, these lesions will continue to appear in crops. इसकी distinguishing feature, this rash can actually look quite scary because it becomes difficult to differentiate it from pyogenic rashes. इसकी इस तरह की flaccid सी lesions होती हैं, and vesicular lesion, इनका differentiating point ये है कि they can rupture very easily because the roof is very lax, and जब ये rupture होती हैं तो they leave this collarette of tissue, and there is a hyperpigmented macule which is left, which can last a few days, and the baby is otherwise well. So again, important to differentiate it from infections, but जैसा मैंने आपको कहा, there will be no systemic signs in the baby, will be feeding well, और ये इसका typical है, leaving a pigmented macule with a collarette. Okay, so then there's acne neonatorum, which can be seen in up to 20% of the babies, and this is basically usually हम whiteheads देखते हैं, like those comedones, and this basically is debris and desquamated skin cells and bacteria which have been trapped in the hair follicles. But if the same lesion becomes open and gets oxidized, then you can have blackheads as well, which are very rare. So this is neonatal acne. The only thing to remember it is that this heals without scarring and goes away within a few months or days. अगर ये persistent हो and stubborn ho and keeps coming back again, then you really must think of virilizing causes in the newborn. So question whether there's congenital adrenal hyperplasia, that would be the commonest virilizing cause. So relentless acne will call for consultation with a pediatrician or a neonatologist. As I mentioned, it represents stimulation of sebaceous glands by maternal or infant androgens. कुछ weeks में transplacental passage of maternal hormones होती हैं, and they can appear under the influence of those hormones. But if they're persistent or relentless, then you have to think of a neonatal and endogenous source from the baby of androgens. Then melia, again, this is what it looks like. So these are pearly white lesions basically seen over the nose or cheeks, and they actually represent a retention of keratin within the dermis. They're seen in up to 50% of the newborn babies, and they again resolve spontaneously within 1 to 2 months of life. Again, a benign rash commonly seen. Miliaria is another condition which can be seen quite commonly in babies who get overwrapped. So this is basically inflammation of the sweat glands that can get obstructed, and later on inflammation can set in. And you know well that if it happens without inflammation, it's miliaria crystallina, which are 1 to 2 millimeter vesicles without surrounding erythema. They are basically seen on head, neck, and trunk, and these vesicles can rupture and desquamate. So this is miliaria crystallina, this is miliaria rubra, and this happens when the babies have been overwrapped. All you need to tell the mother is to take care of the temperature. It's very common for firstborns to be overwrapped. So ये आप देख लें, just tell the mother temperature control करें and it goes away. Then again, a very, very common rash is seborrheic dermatitis or cradle cap. And this is a non-itchy lesion seen on mainly the scalp of the babies, but can also be seen on the inner side of the eyebrows. Again, very distressing for the parents, but it is non-itchy. Our babies isme chill hote hain, there's no problem. Mothers are very disturbed. So you really need to reassure them that this will go away. It can take months for this rash to disappear. Please keep in mind that if it is associated with repeated infections, then you're dealing with an error of metabolism, there's an immunity defect. So this kind of rash or infantile eczema which just won't go away with recurrent infection means that there is some immune deficiency going on. So iski treatment is quite easy. All you need to do is reassure them. What we normally tell is vegetable oils aap laga ke, then brush it off with a soft brush, the scales fall off. But if it's very severe, then you can use tar shampoos or selenium sulfide shampoos, antifungal shampoos, and very rarely steroids. I mean, I don't remember ever using steroids unless it's extremely severe and causing extreme parental distress. Then pigmented birthmarks, again one of the most common dermal melanosis or Mongolian spots. जो dark skin races होती हैं इसमें ये बहुत ज़्यादा visible होते हैं. I'm sure all of you would have seen it in babies in your family, and they're usually present over the sacral area or the buttocks. These are just melanocytes that get trapped in the deep dermis. Again, white races में इतने नहीं होते. So only 10% of white babies में आपको नजर आएंगे, but in Afro-Caribbean races up to 96%, and in Asian races up to 85%. They normally disappear by 2 years of age. The important thing to remember is that they can resemble bruises, and वो तो खैर पूरा setup होता है फिर child abuse का. But if they appear in older children या there are other signs of child abuse, then because they're difficult to differentiate from bruises, इनका भी वही greyish, blackish color होता है, dark blue. This is what they look like. So if you have any doubts about child abuse, please don't miss it at this stage. That's the only importance of this rash Mongolian spots. Then congenital melanotic nevi are more rare. They are seen in 0.2 to 2% of the newborns, and they actually represent disrupted migration of melanocyte precursors from the dermis. They may be flat, they may be raised. Again, they are dark colored, just like Mongolian spots. They can have a hairy surface, and they can be small and they can be quite extensive. So this is what they look like. So this is a garment nevus. As you can see, there's a main nevus and then there are satellite lesions. This again is a moderate sized nevus. उस दिन मैं round कर रही थी तो बच्चे का था, तो I thought I'd take a picture for our presentation. This again is a baby a couple of days ago जिसके एक और nevus था. इसकी importance ये है कि the bigger the size, the more the likelihood of developing malignant melanoma, and of course there are cosmetic concerns as well. So this is found over the trunk, probably less so, but over the face, parental cosmetic concerns ज़्यादा होती हैं. इसकी जो treatment है and the follow-up really depends on what the size of the melanoma is. So this is a guideline that I got from searching the literature for small ones, which in the newborn are less than 0.5 centimeters in size. You just need to observe in a primary care setting. The medium ones between 0.5 and 7 centimeters should be referred to a dermatologist. So ये referral both way पता होना चाहिए. When the pediatrician should be referring a patient to the dermatologist, and when the dermatologist should be referring the patient to the pediatrician or the neonatologist. But you just keep them under observation. For large ones which are more than 7 centimeters on torso or buttocks or extremities, or more than 12 centimeters on the head, they need to be removed and they need a longer follow-up, because there's a real risk here of developing malignant melanoma either on the side or on distant sides. And then the giant ones, of course, the one that I showed you in the pictures, the garment nevus, needs removal and very close follow-up for malignant recurrence. Vascular birthmarks, again very common. The hemangiomas or strawberry hemangiomas, these just represent dilated blood vessels that become obvious. unlike other birthmarks that I mentioned so far, ये जो hemangiomas हैं, they may not be very prominent right at birth. So they tend to become more obvious as the child grows. So they go through a growth phase which lasts about 9 months to a year, and then they kind of regress. And most of these have regressed by 5 years or 10 years. 10 years, almost 100% have gone. इसमें ये होता है, these are benign lesions, but you could have two problems with them. Either they can be on the face and look unsightly and cause parental concern, or they can be over areas where they get traumatized very easily. So buttocks where the baby has to sit, or lips where I remember a child with a lesion on the lips. So when babies are sucking, they can actually get ulcerated and bleed. वैसे ulceration is not a bad thing for these lesions because it helps them with natural regression. But if they're not, if you're not running into such problems, then it's okay to leave them. So this is again angioma on the face. ये baby की wrist पे है, and probably already showing signs of regression. This again is another one we got from our OPD. This is on the baby's chest, but showing signs of regression already. So large size hemangiomas can cause problem two ways. If there are multiple hemangiomas on the skin, then as pediatricians you have to think of hemangiomas on the internal organs. And I still remember working in the UK, we had a baby who came in with circulatory collapse. और कोई पता नहीं चल रहा था कि क्यों circulatory collapse में था. Turned out he had a hemangioma in the liver that had bled massively. So it took us some time before we discovered that. But अगर multiple hemangiomas on the surface है, think of hemangiomas on the internal organs. और दूसरा इसका problem ये, you can have these big hemangiomas that can cause consumption coagulopathy and thrombocytopenia. So the Casabat-Merritt syndrome. So these would need urgent treatment, and they can be treated using छोटे hemangiomas, and nowadays we use propranolol for them with good results. You can also use prednisolone or pulse laser therapy. Then nevus flemmis, again pretty common, also known as port wine stain, because probably port wine होगी जो गिरी होगी तो उसका stain वैसा पड़ा होगा. And they are flat, dark to purple. They respect midline. They don't cross over. Okay. So ये midline को cross over नहीं करते. And if they are present in the ophthalmic division of the trigeminal nerve, then it can be a manifestation of Sturge-Weber syndrome. So this baby can present with fits, he can have glaucoma as well. Nevus simplex, pretty common, 33% of the newborns. ये देखो आपको यहाँ पे नजर आ रहा है. By the way, you can also see these cranial cap over the medial eyebrows. These, unlike port wine stains, do not respect the midline. You cross over कर जाते हैं, as you can see on this baby, and bilateral. These are telangiectatic blood vessels, and really they disappear with time if they happen on the front. इस baby की nose पे उस पे है, तो इसको injections कहते हैं. अगर पीछे हो तो stalk bites कहते हैं. अगले वाले usually disappear. पिछले वाले can persist, but then they go into disappear into hairline and cause less concern. So this is my last slide. Thank you so much.